Diabetes is a chronic, long-lasting disease that affects how your body turns food into energy. Most of the food you eat is broken down into sugar, also called glucose, and released into your bloodstream. Your pancreas makes a hormone called insulin, which acts like a key to let the blood sugar into your body's cells for use as energy. If you have diabetes, your body either doesn't make enough insulin or can't use the insulin it makes as well as it should. When there isn't enough insulin or cells stop responding to insulin, too much blood sugar stays in your bloodstream, which over time can cause serious health problems, such as heart disease, vision loss, and kidney disease. There isn't a cure yet for diabetes, but healthy lifestyle habits, taking medicine as needed, getting diabetes self-management education, and keeping appointments with your healthcare team can greatly reduce its impact on your life. Types of diabetes. There are three main types of diabetes: type 1, type 2, and gestational diabetes, diabetes while pregnant. Type 1 diabetes is caused by an autoimmune reaction. The body attacks itself by mistake that stops your body from making insulin. About 5% of the people who have diabetes have type 1. Symptoms of type 1 diabetes often develop quickly. It's usually diagnosed in children, teens, and young adults. If you have type 1 diabetes, you'll need to take insulin every day to survive. Currently, no one knows how to prevent type 1 diabetes. With type 2 diabetes, your body doesn't use insulin well and is unable to keep blood sugar at normal levels. Most people with diabetes, 9 in 10, have type 2 diabetes. It develops over many years and is usually diagnosed in adults, though increasingly in children, teens, and young adults. You may not notice any symptoms, so it's important to get your blood sugar tested if you're at risk. Type 2 diabetes can be prevented or delayed with healthy lifestyle changes, such as losing weight if you're overweight, healthy eating, and getting regular physical activity. Gestational diabetes develops in pregnant women who have never had diabetes. If you have gestational diabetes, your baby could be at higher risk for health complications. Gestational diabetes usually goes away after your baby is born, but increases your risk for type 2 diabetes later in life. Your baby is more likely to become obese as a child or teen, and more likely to develop type 2 diabetes later in life too. Prediabetes. In the U.S., 84.1 million adults, more than 1 in 3, have prediabetes, and 90% of them don't know they have it. Prediabetes is a serious health condition where blood sugar levels are higher than normal, but not high enough yet to be diagnosed as diabetes. Prediabetes increases your risk for type 2 diabetes, heart disease, and stroke. But through the CDC-led National Diabetes Prevention Program, you can learn practical, real-life changes that can cut your risk for developing type 2 diabetes by as much as 58%. 71% if you're 60 or older. Diabetes by the numbers. 30.3 million U.S. adults have diabetes, and 1 in 4 of them don't know they have it. Diabetes is the 7th leading cause of death in the U.S. Diabetes is the number 1 cause of kidney failure, lower limb amputations, and adult-onset blindness. In the last 20 years, the number of adults diagnosed with diabetes has more than tripled as the American population has aged and become more overweight or obese. What is type 1 diabetes? Diabetes occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and comes mainly from the food you eat. Insulin, a hormone made by the pancreas, helps the glucose in your blood get into your cells to be used for energy. Another hormone, glucagon, works with insulin to control blood glucose levels. In most people with type 1 diabetes, the body's immune system, which normally fights infection, attacks and destroys the cells in the pancreas that make insulin. As a result, your pancreas stops making insulin. Without insulin, glucose can't get into your cells and your blood glucose rises above normal. People with type 1 diabetes need to take insulin every day to stay alive. A young woman injecting herself with insulin. People with type 1 diabetes need to take insulin every day. Who is more likely to develop type 1 diabetes? Type 1 diabetes typically occurs in children and young adults, although it can appear at any age. Having a parent or sibling with the disease may increase your chance of developing type 1 diabetes. In the United States, about 5% of people with diabetes have type 1.1. What are the symptoms of type 1 diabetes? Symptoms of type 1 diabetes are serious and usually happen quickly, over a few days to weeks. Symptoms can include increased thirst and urination, increased hunger, blurred vision, fatigue, unexplained weight loss. Sometimes the first symptoms of type 1 diabetes are signs of a life-threatening condition called diabetic ketoacidosis, DKA. Some symptoms of DKA include breath that smells fruity, dry or flushed skin, nausea or vomiting, stomach pain, trouble breathing, trouble paying attention or feeling confused. DKA is serious and dangerous. If you or your child have symptoms of DKA, contact your healthcare professional right away, or go to the nearest hospital emergency room. What causes type 1 diabetes? Experts think type 1 diabetes is caused by genes and factors in the environment, such as viruses, that might trigger the disease. Researchers are working to pinpoint the causes of type 1 diabetes through studies such as TrialNet. How do healthcare professionals diagnose type 1 diabetes? Healthcare professionals usually test people for type 1 diabetes if they have clear-cut diabetes symptoms. Healthcare professionals most often use the random plasma glucose (RPG) test to diagnose type 1 diabetes. This blood test measures your blood glucose level at a single point in time. Sometimes health professionals also use the A1C blood test to find out how long someone has had high blood glucose. Even though these tests can confirm that you have diabetes, they can't identify what type you have. Treatment depends on the type of diabetes, so knowing whether you have type 1 or type 2 is important. To find out if your diabetes is type 1, your healthcare professional may test your blood for certain autoantibodies. Autoantibodies are antibodies that attack your healthy tissues and cells by mistake. The presence of certain types of autoantibodies is common in type 1 but not in type 2 diabetes. Because type 1 diabetes can run in families, your healthcare professional can test your family members for autoantibodies. Type 1 Diabetes TrialNet, an international research network, also offers autoantibody testing to family members of people diagnosed with the disease. The presence of autoantibodies, even without diabetes symptoms, means the family member is more likely to develop type 1 diabetes. If you have a brother or sister, child, or parent with type 1 diabetes, you may want to get an autoantibody test. People age 20 or younger who have a cousin, aunt, uncle, niece, nephew, grandparent, or half-sibling with type 1 diabetes also may want to get tested. What medicines do I need to treat my type 1 diabetes? If you have type 1 diabetes, you must take insulin because your body no longer makes this hormone. Different types of insulin start to work at different speeds, and the effects of each last a different length of time. You may need to use more than one type. You can take insulin a number of ways. Common options include a needle and syringe, insulin pen, or insulin pump. Some people who have trouble reaching their blood glucose targets with insulin alone also might need to take another type of diabetes medicine that works with insulin, such as pramlintide. Pramlintide, given by injection, helps keep blood glucose levels from going too high after eating. Few people with type 1 diabetes take pramlintide, however. The NIH has recently funded a large research study to test use of pramlintide along with insulin and glucagon in people with type 1 diabetes. Another diabetes medicine, metformin, may help decrease the amount of insulin you need to take, but more studies are needed to confirm this. Researchers are also studying other diabetes pills that people with type 1 diabetes might take along with insulin. Hypoglycemia, or low blood sugar, can occur if you take insulin but don't match your dose with your food or physical activity. Severe hypoglycemia can be dangerous and needs to be treated right away. Learn more about hypoglycemia and how to prevent or treat it. How else can I manage type 1 diabetes? Along with insulin and any other medicines you use, you can manage your diabetes by taking care of yourself each day. Following your diabetes meal plan, being physically active, and checking your blood glucose often are some of the ways you can take care of yourself. Work with your healthcare team to come up with a diabetes care plan that works for you. If you are planning a pregnancy with diabetes, try to get your blood glucose levels in your target range before you get pregnant. Do I have other treatment options for my type 1 diabetes? The National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, has played an important role in developing artificial pancreas technology. An artificial pancreas replaces manual blood glucose testing and the use of insulin shots. A single system monitors blood glucose levels around the clock and provides insulin or a combination of insulin and glucagon automatically. The system can also be monitored remotely, for example, by parents or medical staff. In 2016, the U.S. Food and Drug Administration approved a type of artificial pancreas system called a hybrid closed-loop system. This system tests your glucose level every 5 minutes throughout the day and night through a continuous glucose monitor, and automatically gives you the right amount of basal insulin, a long-acting insulin, through a separate insulin pump. You still need to manually adjust the amount of insulin the pump delivers at mealtimes and when you need a correction dose. You also will need to test your blood with a glucose meter several times a day. Talk with your healthcare provider about whether this system might be right for you. The continuous glucose monitor sends information through a software program called a control algorithm. Based on your glucose level, the algorithm tells the insulin pump how much insulin to deliver. The software program could be installed on the pump or another device, such as a cell phone or computer. Starting in late 2016 and early 2017, the NIDDK has funded several important studies on different types of artificial pancreas devices to better help people with type 1 diabetes manage their disease. The devices may also help people with type 2 diabetes and gestational diabetes. NIDDK is also supporting research into pancreatic islet transplantation, an experimental treatment for hard-to-control type 1 diabetes. Pancreatic islets are clusters of cells in the pancreas that make insulin. Type 1 diabetes attacks these cells. A pancreatic islet transplant replaces destroyed islets with new ones that make and release insulin. This procedure takes islets from the pancreas of an organ donor and transfers them to a person with type 1 diabetes. Because researchers are still studying pancreatic islet transplantation, the procedure is only available to people enrolled in a study. Learn more about islet transplantation studies. What health problems can people with type 1 diabetes develop? Over time, high blood glucose leads to problems such as heart disease, stroke, kidney disease, eye problems, dental disease, nerve damage, foot problems, depression, sleep apnea. If you have type 1 diabetes, you can help prevent or delay the health problems of diabetes by managing your blood glucose, blood pressure, and cholesterol, and following your self-care plan. Can I lower my chance of developing type 1 diabetes? At this time, type 1 diabetes can't be prevented. However, through studies such as TrialNet, researchers are working to identify possible ways to prevent or slow down the disease. What is type 2 diabetes? Type 2 diabetes, the most common type of diabetes, is a disease that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and comes mainly from the food you eat. Insulin, a hormone made by the pancreas, helps glucose get into your cells to be used for energy. In type 2 diabetes, your body doesn't make enough insulin or doesn't use insulin well. Too much glucose then stays in your blood, and not enough reaches your cells. The good news is that you can take steps to prevent or delay the development of type 2 diabetes. Who is more likely to develop type 2 diabetes? You can develop type 2 diabetes at any age, even during childhood. However, type 2 diabetes occurs most often in middle-aged and older people. You are more likely to develop type 2 diabetes if you are age 45 or older, have a family history of diabetes, or are overweight or obese. Diabetes is more common in people who are African American, Hispanic/Latino, American Indian, Asian American, or Pacific Islander. Physical inactivity and certain health problems such as high blood pressure affect your chances of developing type 2 diabetes. You are also more likely to develop type 2 diabetes if you have prediabetes or had gestational diabetes when you were pregnant. Learn more about risk factors for type 2 diabetes. A smiling, overweight older man. Type 2 diabetes occurs most often in middle-aged and older people. What are the symptoms of diabetes? Symptoms of diabetes include increased thirst and urination, increased hunger, feeling tired, blurred vision, numbness or tingling in the feet or hands, sores that do not heal, unexplained weight loss. Symptoms of type 2 diabetes often develop slowly, over the course of several years, and can be so mild that you might not even notice them. Many people have no symptoms. Some people do not find out they have the disease until they have diabetes-related health problems, such as blurred vision or heart disease. What causes type 2 diabetes? Type 2 diabetes is caused by several factors, including overweight and obesity, not being physically active, insulin resistance, genes. Learn more about the causes of type 2 diabetes. How do healthcare professionals diagnose type 2 diabetes? Your healthcare professional can diagnose type 2 diabetes based on blood tests. Learn more about blood tests for diabetes and what the results mean. How can I manage my type 2 diabetes? Managing your blood glucose, blood pressure, and cholesterol, and quitting smoking if you smoke, are important ways to manage your type 2 diabetes. Lifestyle changes that include planning healthy meals, limiting calories if you are overweight, and being physically active are also part of managing your diabetes. So is taking any prescribed medicines. Work with your healthcare team to create a diabetes care plan that works for you. A smiling young woman chopping vegetables in her kitchen. Following your meal plan helps you manage your diabetes. What medicines do I need to treat my type 2 diabetes? Along with following your diabetes care plan, you may need diabetes medicines, which may include pills or medicines you inject under your skin, such as insulin. Over time, you may need more than one diabetes medicine to manage your blood glucose. Even if you don't take insulin, you may need it at special times, such as during pregnancy or if you are in the hospital. You also may need medicines for high blood pressure, high cholesterol, or other conditions. Learn more about medicines, insulin, and other diabetes treatments. What health problems can people with diabetes develop? Following a good diabetes care plan can help protect against many diabetes-related health problems. However, if not managed, diabetes can lead to problems such as heart disease and stroke, nerve damage, kidney disease, foot problems, eye disease, gum disease and other dental problems, sexual and bladder problems, Many people with type 2 diabetes also have non-alcoholic fatty liver disease, NAFLD. Losing weight if you are overweight or obese can improve NAFLD. Diabetes is also linked to other health problems such as sleep apnea, depression, some types of cancer, and dementia. You can take steps to lower your chances of developing these diabetes-related health problems. How can I lower my chances of developing type 2 diabetes? Research such as the Diabetes Prevention Program, sponsored by the National Institutes of Health, has shown that you can take steps to reduce your chances of developing type 2 diabetes if you have risk factors for the disease. Here are some things you can do to lower your risk. Lose weight if you are overweight, and keep it off. You may be able to prevent or delay diabetes by losing 5 to 7% of your current weight. 1. For instance, if you weigh 200 pounds, your goal would be to lose about 10 to 14 pounds. Move more. Get at least 30 minutes of physical activity, such as walking, at least 5 days a week. If you have not been active, talk with your healthcare professional about which activities are best. Start slowly and build up to your goal. Eat healthy foods. Eat smaller portions to reduce the amount of calories you eat each day and help you lose weight. Choosing foods with less fat is another way to reduce calories. Drink water instead of sweetened beverages. Ask your healthcare team what other changes you can make to prevent or delay type 2 diabetes. Most often, your best chance for preventing type 2 diabetes is to make lifestyle changes that work for you long term.